Hello and welcome to the Nurse Station. My name's Maria Mobley and we are currently in this mini-series where I post a question, you pause the video, you break down the question, and then watch me break it down. And my hope for this is to give you test-taking strategies, question breakdown skills. I know you get wonderful content from your teachers, but I struggled. I cried after I took the NCLEX because I didn't really know how to do this. So I just wanted to make sure that nobody else felt that way when they were going into the NCLEX. So I hope this helps. And if not, I just encourage you to have a way to break down a question. So pause that video and take this question. All right. So there's a key word in here. Remember, Maslow's identifies your topic of the question every time in nursing. And I'm going to point out a key word that changes this question, all right? So the nurse is assisting with blood pressure screenings at a health fair. This is important, a health fair. So we don't have a lot more information, but community health fair, what is the setting? But you're not the primary nurse. You are kind of there assisting to screen a lot of individuals coming, but you are not the primary healthcare provider or the primary giver of care. Does that make sense? So this setting is important, okay? Upon assessment of a 54-year-old female client, the blood pressure is 160/90 millimeters of mercury. What priority? So we know we have a lot of good answer choices. We got to get to the best one. Action should the nurse take first? So if you've already learned about hypertension, you are well aware that one high blood pressure screening does not give a diagnosis of hypertension. We have to collect more data, right? So a lot of y'all might have labeled this right now circulation. I'm sorry, risk of circulation. And therefore you might gather more data to try to figure out if it's a right now circulatory problem. I just challenge you, and you don't have to agree with me. They are at a health fair. What are your resources, right? You, as a health fair nurse, a triage nurse screening blood pressures, you don't have IV medications to give if the blood pressure is high. You don't have a healthcare provider right there to treat this patient. That's not this setting. This is a health fair, okay? So I would label this right now safety. I'm not saying I can prove hypertension. I'm not saying that I know anything else because all I'm doing is gathering blood pressure, right? That's the only data I have. But I'm just saying that's too high and it's a safety issue and my patient I need to pick a safety action, okay? So I label this right now safety because of this setting, because of where I am. I'm at a health fair, just screening a lot of people for blood pressure, okay? So if I label it right now safety, I need a right now safety action. If you labeled it risk of circulation, because we know one blood pressure alone cannot give a diagnosis of hypertension, you would have assessed, right? So most likely you would have obtained another blood pressure reading. But it says, what is your priority action? I want y'all to picture, you are going to do one thing and one thing only for this patient, and you're going to leave, and you can't do anything else. You need to pick the answer choice that is what is best for them. Don't tell me that you're going to do this answer and then this answer. No. This is, what is your priority action? You can do one action, and you've kept them the safest. And don't get stuck on verbiage. Y'all know what I'm saying. If you have no assessment data, gather data. It's just verbiage, this action. But I am thinking I can do one thing and one thing only for this patient. I know I've kept them the safest. So we're going to label our answer choices assessment versus intervention. I say it's a right now problem, so I need an intervention. If you said risk of, you would gather more data. All right. So I need an intervention. Educate that more than one high blood pressure reading is required to diagnose hypertension is an intervention. Interview the client regarding home medications. That's an assessment. You're gathering data. Obtain another blood pressure reading. That's an assessment. You're gathering data. Educate the client on the importance of exercise and diet. That's an intervention. Instruct the client to be seen by a healthcare provider as soon as possible. That's an intervention. I would get rid of these two, okay, immediately, because again, you're at a health fair. So what is your priority action? You walk in the room, you do one thing and one thing only, and you leave, and you interview the client. What are you going to do with that? You're going to have to do another step. This question, the NCLEX is just trying to say, are you safe? Can you pick the best answer choice, okay? These two once you get that data, what are you going to do with it, right? You can only pick one answer. You can't say to the NCLEX, I'm going to do this and then that, all right? So get rid of that. If you did this, you did not help the problem at all. Yes, we can't diagnose hypertension with one blood pressure assessment, but how did you help them? Their blood pressure is still high. This is an unsafe answer, so I would have immediately gotten rid of that one too. Now, we're looking at these two. I said my topic according to Maslow's is right now safety. I need to educate I need an intervention and action that's safety. Educate the client on importance of exercise and diet. That's related to circulation, okay? You're trying to talk, that's important for instance, hypertension. But this is a safety answer choice. I need you with this blood pressure to see a healthcare provider as soon as possible. And then they can gather data, they can prescribe, they can make sure to keep this patient safe. So if I can only pick one answer choice, I'm picking this one. And again, I tell my students all the time, you don't have to agree with me. This is just what I would pick after, a long time of being a nurse and practicing a lot of questions and writing a lot of questions. This is what I would pick. Now, if you need help with Maslow's, again, the link is in the description. If you need help with breaking down this style of question, I have a much more detailed video in the description. And as always, I just hope to give you tools, right? If this doesn't work, I just encourage you to find your way. You can do it. You can pass this NCLEX. Us experienced nurses need you at the bedside. So take care.